Hi, everyone. Welcome to this week's edition of It's Worth a Shot. As usual, we'll just let everyone have a few extra moments to join us from the waiting room. I see a few people trickling in. I hope that wherever you are joining us from today, you aren't in a blizzard. As I look out my window, we are in the midst of a blizzard. A few more people joining us. I'll just give them a few. All right, well, welcome to this week's edition of It's Worth a Shot. My name is Jessie Kinsey. I'm an account manager with Mountain Pacific Quality Health, and today is February 8th. And today we will be discussing a few updates about the COVID-19 therapeutics and also covering some Mountain Pacific vaccine resources. I see, Liz, you're lucky you have sunshine. Blizzard in Lewistown, Montana. All right, with that, next slide, please. So a few updates. There is a roundtable discussion that's being hosted by CMS next week, February 14th on Tuesday, and they will be discussing COVID-19 booster rates, methods to improve, and general use of therapeutics by residents in post-acute and long-term care settings. And as we go through our presentations and resources today, I will be sure to drop the link in the chat box for you to register for that event. Again, that's next Tuesday, a special roundtable to talk about booster rates and therapeutics. Also, we are working on developing a NHS-IN webinar. So I invite any topic ideas related to maybe common concerns or problems that you're running into that we can help offer some troubleshooting tips with. If you want to email me directly or you want to drop those in the chat box as we develop that training session for NHSN, we are all ears. We want to make sure that that time is most valuable for you for that session. So again, drop in any suggestions for us to touch upon when we develop that training. Next slide, please. As always, feel free to add any webinar topics or clinician ideas into chat. And we have a couple polling questions for you today. First question, do you feel like you can increase your resident COVID-19 vaccination rates in your centers? Yes or no? Give you guys just a few moments to answer it. And do you feel like you can increase your COVID-19 vaccination rates? 50-50. All right, fair enough. All right, Mary, we can end that poll. And then we have a second polling question for you. So reevaluating the frequency of this series, this weekly webinar Worth a Shot, we want to just touch base and see if the timing is great to continue every week or if you would like to look at some other timelines. So I'll just let you go through and read those options. Thanks as always for taking the time to respond to these. Looks like pretty close between continuing every week or going to every other week. All right, we can go ahead and end that poll. Thank you, Mary. All right, next, perfect. So as we take a look at our weekly influenza snapshot as a whole, we're continuing to see a decline on those averages across the country as far as influenza positive tests being reported to the CDC. This is wonderful news. I just want to share something though relative to this, to be mindful of that second wave. And I'm going to share my screen really quick, Mary. All right, so I just wanted to point out, even though we're continuing to see a national decline, oh, and I hope everyone can see my screen. Someone want to just let me know? Okay, perfect. So as we continue to see that national decline on influenza rates, just be mindful to be looking at your local activity. And I wanted to point out for Montana, for example, and Wyoming came on the radar as well. We are seeing some increase in cases in some areas of the state, or still some high level reporting. So just to be mindful of that. I know just from my perspective, we have tournaments in high school going on, a lot of community interactions and sports type stuff. And for some of us, we're traveling, and just to know that we still have some flu happening, even though the national statistics are declining, we still have hot pockets in some areas. So when I sent out that one-page flu resident facing resource yesterday, that was really what I was referencing, is just be mindful of some counties or pockets in your state. Wyoming reported 74 new cases of influenza last week, and that was mostly located to the north central and southeastern part of the state. But again, just something to share forward. So Mary, I'll give you the screen back. And next slide. So with that, a weekly COVID-19 snapshot, again, positive news. We are overall seeing the COVID-19 cases trending downward. Again, those death statistics seem to be going up and down, kind of an inconsistent line that we've seen week after week. Hospitalizations are tending to go down. Vaccination rate, we are seeing a small increase up to 15.7% this week. When we look at this report. And again, I just wanted to highlight that even though these trends overall across the United States are trending down, just be mindful of your region and local hospitalization rates. Some parts of our region are seeing a little bit of an increase. I believe Alaska, and I will go ahead and screen share again, Mary. Thank you, Mary. There we go. So for Alaska, for example, even though we're seeing that nationwide downward trend, we saw a little bit of an uptake in Alaska this last reporting period. So just sharing that forward, continuing to encourage vaccination rates, and being mindful of your community cases. I'm gonna stop sharing again, Mary. All right, and next slide, please. So with that, we thought we would take a few moments and touch base and share forward some COVID-19 therapeutic updates. There has been a few just within the last couple of weeks. Next slide, please. So the primary one is that Evishield is no longer available on the market. That was actually discontinued on January 26th. So that wiped out the last monoclonal antibody that was available. However, we still do have several treatments that are continuing to demonstrate effectiveness against COVID-19 and those circulating variants. That's going to be Paxlovid, that Veklury, the remdesivir, or the Lagevrio, the molnupiravir. All right, next slide, please. So with that, the Paxlovid, I'll just touch base upon first. And this is the oral antiviral. Um, it, it is recommended to start this medication as soon as possible within the first 5 days of when those symptoms start. So this medication, it up until recently, you had to have a positive test to prescribe this medication, and they just changed that as well last week. So this medication, as soon as you have symptoms, you can start, and you do not necessarily have to have a positive COVID-19 test. They changed this requirement, just recognizing that obtaining a positive test was a barrier in some circumstances. So that they updated that just to in attempt to decrease those barriers. The other component to Paxlovid, just as a on an informational note, there was a lot of medication errors early on with this medication because it comes duly packaged. There's actually 2 pills, 2 different medications in the same package, and you have to be mindful of pretty much the format of that packaging that you give the doses that are prescribed. And based on the dose, they come in 2 different packages now, kind of in response to those med errors that we're seeing early on. I like to share forward that information because when you receive this dispense from the pharmacy, it does look a little different. So there is an opportunity just to make sure that your staff are well informed on what pill to give or your dose. So again, just to be mindful of the packaging does look a little different with this Paxlovid. And they have readjusted some of the Kyla just added a note in the chat too. The 2 different forms in which they dispense this medication, it's all based on renal dosing. So you'll see that one has more pills in it than the other essentially. But again, just kind of a awareness if you look towards prescribing this medication that your staff, your nurses are aware. And just checking the chat box here. And also on Paxlovid, you you're not supposed to crush this medication. So that has come up quite a bit too for those that might be unable to swallow the pill whole. However, the manufacturer is conducting a study after there has been quite a bit of outreach, and they're looking into data to see if crushing truly does impact the effectiveness of Paxlovid. Right now, the manufacturer's response is that there really isn't enough data, but they continue to recommend you're not supposed to crush it. So stay tuned for that information, but they are, looking to see if that's a barrier to providing this medication. Next slide, please. So remdesivir, this is the other antiviral that's still available. You would want to start this as soon as possible, and really you need to begin it within 7 days of when those symptoms start. This is IV. So this IV is going to be for 3 days, 1 dose a day for 3 days. And the infusion, again, based on dosing, is going to be anywhere from 30 to 120 minutes. And, you're going to want to make sure that you have dedicated time to not only start this infusion, monitor this infusion, and then monitor post-infusion for at least an hour. Again, this is a once a day infusion for 3 consecutive days. And this is the second in line as far as recommendation and proven to be effective against decreasing severe illness and hospitalization with those with COVID-19. I know this one has been a little bit challenging as far as administration in our long-term care centers. And this is where I would just encourage you to work closely with your pharmacy and your providers and have a plan in place and provide that education ahead of time to your nursing staff so that in the event you do have a candidate that would benefit from this medication, you're prepared to administer it. Now this with this infusion for once a day for 3 days, that's the standard dosing if they were to stay in your facility, in your long-term care community. If they were someone that was severely ill in the hospital, this is the infusion that they would probably be extending up to 10 days and then higher dose. All right, next slide, please. So the third therapeutic I was going to discuss today is the molnupiravir. That is another antiviral for adults that you will want to start as soon as possible. And this one is an oral medication, just like the Paxlovid, and you will need to begin this one within 5 days of when symptoms start. And part of that updated guidance related to therapeutics that was released last week, I believe it was, this was included with the Paxlovid statement that you no longer have to have a positive COVID-19 test in order to write for this prescription. Again, just identifying that may help overcome barriers to access. I do see the chat box lit up with some questions, so I want to make sure I'm not missing them.
So Jesse, I think Joyce had a question about rebound with Paxlovid. And what we're seeing so far is the rates of rebound in patients that are being treated with Paxlovid versus patients that just have the disease and have rebound are the same essentially. And we haven't seen a significant difference clinically yet or statistically yet. So just to speak to that question. And then I haven't heard of oral remdesivir, but somebody had a question about if there's any updates on that.
Yeah, that is a really good question, and I haven't heard that either. And I did see the comment about expensive, and whoever said that, Maria, you are 100% right. That has been identified as a definite barrier, and there are some discount codes and manufacturer codes that we can share forward. They are posted to our website. I'll track them down and throw them in chat, but they are supposed to help alleviate the cost of remdesivir. But yes, at one point, I think I looked at it and it was about $1,000 a dose. So for the 3 doses, it was almost $3,000. Yeah. Yeah, but if you use these coupon codes, it brings it down. So I can, and I don't know if coupon codes is the right word, but they're a manufacturer code that you can apply towards the payment. Good questions. Kyla, you see any other questions?
I see Ivan has a question about recent efficacy data for molnupiravir versus Paxlovid, and I think we have that in the next slide actually.
Yeah.
Molnupiravir is a lot less effective. That's why it's recommended second-line therapy. And then a note about having to receive labs before Paxlovid. That's to make sure that the renal function, to find out what the renal function is and which dosing regimen we need to use.
Yeah, thank you. Yeah, so when we look at the overview of therapeutics and we look at remdesivir, it's about 87% effective in reduction of hospitalizations and deaths. Paxlovid's about 88% effective in reduction in hospitalizations and deaths, while the molnupiravir is about 30% effective in reduction in hospitalizations and death. And I will just add a comment too, as far as some clinical information, for a nurse that may be providing the molnupiravir. This comes in capsules at this time. And kind of another note, you wouldn't want to crush these. You wouldn't want to open them, break them open. They need to stay in their whole state. So just a little tidbits there. All 3 of these treatments are approved for treatment of mild to moderate COVID-19. So, they may not be something that you can satellite locally from your pharmacies for those of you that have a long-term care pharmacy provider, but this may be something that you can order from your long-term care pharmacy provider and have in your next delivery or shipment. And I see some more questions. Did we get them all, Kyla? Maybe we did.
I think so.
Okay, next slide, please. So with that, we just want to make sure that we have a strong plan as we look at these therapeutic options. Talk to your providers, make sure that you're developing some kind of standing order as appropriate or some kind of order set. Educate your staff on the nuances of some of these medications, not to crush, not to open the capsules, maybe some refresher education on starting an IV and monitoring infusion therapy. Don't delay, make sure you test soon and treat early. Talk with your pharmacy on the process to obtain and turn around. To obtain it and the turnaround on obtaining that medication. So for example, some of these may be very much so supply related as far as remdesivir. Your pharmacy can obtain it, but it may take a day for them to obtain it and then turn around and ship it to you. So just make sure that you're aware of that turnaround time and make sure that you ultimately are maintaining some kind of long-term vaccine plan because really the vaccinations are proven to be significantly effective in lowering the risk of dying from COVID-19 compared to unvaccinated individuals. And Callie and Kyla just dropped in some great links to some resources in the chat box, and I will do the same. Any other questions?
Hey, I see one more question, Jesse.
Yeah.
From Cindy, she said, I thought the federal government was providing Paxlovid and other COVID treatments at no cost. Did this change? So the oral treatments are available, but remdesivir is something that you have to order and actually bill. And that's why the cost is a barrier on that one.
Thanks for catching that. Yeah, remdesivir went commercial. It was covered and then it went commercial. So yes, there is a charge associated. Good question. And then Ivan shared a resource. Looks like just some concerns maybe about molnupiravir that are being studied. Interesting. Okay. So we'll drop some resources in the chat. And next slide, please. So with that, I will pass forward to my colleague, Callie Perkins in Wyoming, who's going to be sharing some wonderful Mountain Pacific developed vaccine resources. Thanks, Callie.
Thanks, Jesse. Thanks for having me on today. We'll go ahead and skip to the next slide. We wanted to take this opportunity. To go over some of our vaccine resources. Oftentimes when we present, we'll list them out and not give a lot of detail on to all of the different resources that we have available. So we just wanted to go into just a little bit more detail on each one of these. So for vaccine clinic resources, we do have a fillable flyer template, and that one is on the left of the screen here. You can plug in the date, time, place for your clinic, and it's fillable. Then each time you have a clinic, you can just kind of quickly pop in there, update the date, time, and place, and then print and hang them by your time clocks or by the resident areas, wherever is most convenient for you guys. And then on the right-hand side of your screen is the COVID vaccine declination form. Again, that one's kind of a preloaded form, and that way you can enter the information and just print it off, have them sign it. Just a couple of quick resources for you guys. Next slide, please. The next two have to do with vaccine tracking resources. The first one is a tracking tool for both resident and staff vaccine. I know this is something that we all struggle with, is tracking who's been vaccinated, who's been offered, kind of where we're at with everything, with all of the different primary series and your bivalent now. So this is just a tool to help you track that. It is an Excel spreadsheet, so you can plug your information in and update it as you go. And then the second one is more for quality reporting, so you can show the vaccine rates of your residents. You can look at it by vaccine status, the booster status, and then also the bivalent. So, and this is an example of what that would look like. So just, again, another easy dashboard for you to share with your staff and your residents and family members. So next slide. And then one thing that I know that a good majority of us are dealing with is vaccine hesitancy. So Mountain Pacific has created some bivalent booster letters. There's a couple of different ones that we have drafted. We have a letter to the director. So this one goes to the medical director and just kind of helps emphasize the importance of the COVID vaccine. The next two, which I've included an example of on your left, is the Dear Resident letter. And again, that helps convey that message of why it's important to be vaccinated. And it also covers more than just COVID. It talks about influenza, pneumonia, and other respiratory illnesses. So just, again, kind of conveying the message of why it's important. This one can be customized to your facility. You can put your letterhead on it and then, again, customize it to kind of personalize it for your facility. The other resource I have shown here is the COVID-19 bivalent vaccine. Jesse and Kyla put this together. This addresses the top 10 kind of questions about the bivalent vaccine and kind of busts those myths, if you will. It's a really great resource. This is something that you can provide to your staff as well as your residents and family members to kind of help overcome some of the vaccine hesitancy. And then the last one is the COVID-19 vaccine guide specific to long-term care. This one is a much more in-depth, detailed information regarding COVID-19 vaccine in your facility. Okay, next slide. So in addition to COVID, we also have resources available for other vaccines. So we have the standing order for the pneumococcal vaccine, and we also have the diabetes and adult vaccines resource. This one is really great if you have a diabetic resident or patient that you're working with. It just kind of helps reiterate the importance of vaccines with diabetes. And Jesse touched on influenza and our influenza rates currently. Right now, with the potential second wave coming, the influenza and RSV guide is great. It also touches on influenza and COVID vaccination as well. So, and I just kind of did a snippet for you, but the influenza and RSV guide talks about cohorting and how to manage all three of those when they're in your facility at the same time. So that's a really great resource that we have available. One thing that I want to just put out there for you guys, we are all about resource development. So if you guys have ideas or needs, things that you would like to see, just let us know. You can plug it in the chat and we can work on that. And we may already have a resource for it. So just let us know. Go ahead and go to the next slide. And then one thing that's coming is it's hot off the press, is our NHSN frequently asked questions for long-term care facilities. This one is a great resource, especially if your facility is struggling getting enrolled in NHSN or switching somebody over. We've seen quite a bit of turnover on who is doing that NHSN reporting. So this is a really great resource and a good handoff tool if you have a new IP or a new administrator coming in. This is a good tool for that. And then coming soon, we're working on the multi-vaccine consent form. And then as always, we want you guys to join us on Wednesdays for our It's a Shot webinars. And next slide. And if I cannot stress this enough, bookmark this link, put it on your toolbar. We have tons of resources from everything from vaccine to COVID-19 to infection control, MDS, quality resources, root cause analysis, emergency preparedness. So we are a wealth of resources. We're trying to keep our website up to date and have it be current for you guys at all times. And like I said, if you guys are interested in anything, just let us know. We would love to help you get connected to those resources. Great. And next slide, please. Do you guys have any questions?
Thanks, Callie. I see a few things in chat. There was some great questions from Liz regarding timing of labs and starting Paxlovid. And Kyla just inserted some information from the FDA that they've really broadened the timing of labs. There's some language adjustments, and she inserted the guide in the chat box. So feel free to take a look at that. Because again, you're right, Liz, that was a recognized barrier for access to therapy is getting those labs. So there is a resource there. And then there's also some a resource that Kyla dropped in the chat for providers to address the drug interactions. And there's a nice little tool in the chat box to look at that too. And then I just added, as far as therapeutics, they just released, as in last week, a side-by-side guide for therapeutics. I put that link in the chat for you. Check that out. Very nicely done. And then they also, you've probably seen this second guide here for clinical decision making on the therapeutics. It was nicely done. It was done in December. So I added the link for that in the chat box as well. And then Callie referenced a link to save and bookmark. I added that in the chat. You guys had great questions today. And then anyone, Holly has a question for the audience as we wind down our time today. What approach for vaccine hesitancy are folks taking? What is working best? To answer, feel free to come off mute or drop that in chat. We'll see if we can see what folks are doing in other areas, Holly. She wants to know, are you using declination forms in addition to the exemptions? And Cindy in Alaska, do immunizations administered in long-term care facilities typically get transmitted to state immunization information systems? Cindy, great question. So Alaska folks, are you using Backtrack? So each of our states, I know we have different immunization information system reporting, and we're really recognizing that our long-term care communities have an opportunity to use it a little bit more. Does anyone want to say they're using it? That's in a nursing home. Cindy, we'll see if we can find some more information there for you too. Oh, good. There's a few folks. Yep. Yes, and it is written into legislation for the state of Alaska. And Cindy, it looks like some folks have to manually add it in if they don't have that connection on their EHR platform. So that may be a barrier to keep up with it. Good question. Great question today. Callie, thank you so much for sharing those resources. Any questions for Callie? All right. Well, thanks as always. Feel free to please fill out that post-evaluation or post-presentation evaluation. The link is in the chat. We'd love to hear from you. And if you think of any questions, have any needs, as always, don't hesitate to reach out to us. Thank you all for joining us today, and be well. See you next week.